Welcome to Understanding CK Levels. This section is entitled CK Levels and Newborn Screening. Parent Project Muscular Dystrophy is grateful to have this education provided by Dr. Bo Lee. Dr. Lee is a pediatric neurologist at the University of Rochester in Rochester, New York, who specializes in neuromuscular disorders, including Duchenne and Becker muscular dystrophy. Why is CK level a measurement that can and we expect will be used for newborn screening for Duchenne?
There are a couple of considerations when choosing a marker to use for newborn screening. So firstly, newborn screening is done through something called a dried blood spot. And this is when they take a little bit of blood from the heel stick of a baby's foot and they put it on a little card and that gets sent to the state's screening lab for testing. So the marker we use, one, needs to be stable and accurate when dried like that, and then also feasible to do on a very large scale because nearly all babies born in the United States will get newborn screening. And then secondly, we want to use a lab marker that will correctly identify those who are affected and screen out those who are not. And so even though boys don't show symptoms of Duchenne at birth, CK will be elevated, which makes it a very good marker for the condition at the time of newborn screening.
What could cause a false positive CK level on a newborn screen for Duchenne?
There are a few things that can cause a false positive newborn screen for Duchenne. And that's because we use CK and not genetic testing. And so while CK has really great sensitivity for Duchenne, it's not going to be 100% specific. And so some common causes of false positive screens are going to be things like birth trauma or infection during the neonatal period, certainly other muscle disorders. We also know that CK is typically higher in the first sort of 24 to 48 hours right after birth, because if you think about the process of birth itself, even if it's like a C-section, it's a relatively physically demanding process for newborns. So depending on exactly when the screen is done and whether it's repeated, that can really help you think through whether a result is more or less likely to be a false positive.
Do you think CK and the newborn screen will detect 100% of people with Duchenne? Or if not, what could cause a false negative?
So ideally, the goal would be to be able to detect everyone with Duchenne, but no screening test is going to be perfect diagnostically. And so some considerations are that there might be some variability between the lab cutoffs, meaning how high the CK has to be considered a positive screen on the newborn screen. And just like there are factors that increase and elevate CK, there are also factors that decrease CK. For example, prematurity and having a very low birth weight are known factors. So if the CK measurement from the screening sample is below the cutoff, it could be possible that the baby doesn't get picked up through newborn screening. And we know from prior pilots and newborn screening programs that it's not very common, but it has occurred. And then lastly, I'll just add that while it's very rare, there's always a small risk of technical or human error.
Do you think newborn screening will detect people with Becker muscular dystrophy or people who are carriers, heterozygotes?
Yes and no. And that's because for both people with Becker muscular dystrophy and for DMD carriers, the CK elevation at birth is a little bit more variable than in DMD or Duchenne. But pilot studies and newborn screening programs that have been implemented so far definitely have detected both.
What should a parent do if they get a call about a positive CK screen for Duchenne?
So I would say first and foremost, and I know that this is way easier said than done, I would try not to panic. As we've discussed, a CK is a screening test, and alone is not diagnostic. Depending on the state you live in, the pathway of evaluation might differ, but it could include either repeating the test since the CK tends to be highest in the first couple of days, which is when the newborn screen is typically done, and often normalizes thereafter, or it could be directly to seeing a genetic or neuromuscular specialist. So if you're a parent or a family member, I would try to be selective about the resources you look to for that information. And if you're a healthcare provider, certainly I would recommend that you look at your state's screening protocol and then discuss with your neuromuscular colleagues sort of the guidance for next steps.
What else should families and healthcare providers know about CK levels? What do you wish to tell people, or additional education you think people should have?
I would love to add a reminder that newborn screening programs are, one, state dependent. You can't assume your state screens for Duchenne just because there are other states screening for Duchenne. And even if your state does have newborn screening for Duchenne, remember that any child that's presenting with developmental delay warrants a CK. It's really a great screening test, both in and out of the newborn phase of life. And so I just want that to continue to be on the top of mind of anyone who comes in with developmental delay, get a CK.